child, and I'm coming from a background of like generational curses. Nobody's been married, nobody's finished school, like all of that stuff. Like that's where I come from. So for me, it was like you're kind of pioneering a lot of new things. You're doing a lot of different things, like as a new father and everything like that. So like there's that euphoric like, oh, this is exciting. Like even while I was in Jamaica, I'm like thinking about like, oh, I can't wait to like do this with my son. I can't. I'm like going on Google and I'm like, I can't wait to buy him this. And then I'm like downloading there's like apps you can buy
A
for like the track
pregnancy map and stuff
the
like that.
pregnancy.
Yeah.
So I'm like doing it and I'm getting a little like antsy. Like I'm a very like eager person. So I'm skipping to like, what does week 13 and 14 look like inside
Want
the
to know
belly of
what
like,
the weeks ahead are coming to be and stuff. That was me.
yep.
That was me.
So I'm living and basking in all that. And then there's that moment of like, I can't wait to tell everybody, right?
Hmm.
So I'm like in Jamaica and I'm sitting with like all of this like burst of like goodness and energy and all kinds of goodness. And then we come back and then we start my wife she finds a doctor. She was very adamant on finding a person of color who was gonna be able to because my wife is black and she wanted to make sure the person understands the black female's point of view or their body
That
and
they
everything
can
like that.
trust.
Yeah, and they can trust and relate to.
Hmm.
Fair enough. We go, we see the doctor. I feel good about him, and like everything is going good all the way up until like we're doing these visits, and we got pregnant when she was 35, so we're considered like that high risk
High risk
pregnancy.
area. Yeah.
So you got to go a little bit more frequently to the doctor. So we're going, and then I want to say week it had to be like the week 12 visit, which is probably where everyone starts to starts to show or it happens, right?
Hmm.
The crazy thing about our week 12 visit is our doctor happened to be on vacation and he kind of like gave us a heads up like, hey, I'm going to be away, the nurse is going to take care of you, just, typical scan, blah blah blah, right? When we went to the visit, we're in there with the nurse and I'm like, I can see that big black hole. Like you see the baby on their back, and then it's almost like a small little ball, and then there's like the skin over it. It's just like it looks kind of like bizarre, but like now, I'm thinking like, oh, they would have said like that's the part where I want people to also know about. Like I'm thinking she would have
That
said
they're gonna
something.
say something to us. That's what I thought as well.
Right. You're thinking they're gonna say something if something is wrong. So I'm just like la 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 ooh. And I'm like thinking to myself, well, maybe he's got a full belly, or it's like maybe like not even really paying mind. Go about the day, go about the weekend. I had to travel to Denver for work that next week, so I'm just like chugging along, blah blah blah. My wife calls me when we're in Denver, and we wanted to do a what's it called?
Gender
A
reveal.
gender. Thank you. We wanted to do a gender reveal. So wife calls me up and she's like, "Hey, the doctor found something." And the way she was talking, I didn't get concerned about it because she was like, doctor just wants to see us and blah blah. So I'm like, okay, cool, like no problem. She's like, also, he told me what the sex of the baby is, and I'm like, do you want to know? And then in the back of my mind, like, no, why? Like, you're not. At least for me, like I'm just giving you the dad views. So I'm super excited to hear what you have to say. But like for me, it's like, oh, I don't want to know. Like, no, 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 do we have to know? Like, no, you kind of have to because it only impacts one gender. So I'm
Hmm.
like disappointed. I'm like, oh, I was kind of waiting to be excited. But then she's like, it's a boy. I was like, it's a boy. I'm super, again, I'm getting the feels. I'm getting lifted up. This is so exciting. I'm going to have a boy, first boy. And I'm just like, man, life feels complete. Like life
Like
is
everything's falling the way that
every,
you want it to go.
right, especially from where you come from.
Hmm.
So, life is feeling complete, and she's like, you need to take, just take a look at this. It's called LUTO. It's lower. He said the baby has lower urinary tract obstruction. So, I think I do what probably every single parent has done as soon as you find out what it is you go on Google, and the first thing you come across is like breadcrumbs of information that leave you asking even more questions,
Hmm.
or you're thinking like, okay, it's not really a big deal. Okay. So I'm like, okay, so I look at it and I'm just saying like documents from Harvard. I'm saying that this doctor wrote something. Everybody's just kind of explaining what it is, and then you see like 10,000 people impacted per year, but like you don't see a whole lot of information on like treatment, right? And I'm like, okay, is there a treatment? And it's kind of like you get mixed information.
Mm-hmm.
And the next thing I did is, okay, fine. I can't find it on the internet. What do you go to next? You go on Facebook and you start looking to see, okay, anything in search.
Mm-hmm.
Then I came across the Ludo group on Facebook, but like it was more so a community for everyone to kind of come together and talk about what's happening, less
Mm-hmm.
of, hey, this is what the outcomes look like. So I still wasn't getting that. Then we go to the doctor's office finally when I get back for our appointment, and he breaks it down for us. But he doesn't tell us like there's a possible chance of mortality. He just refers us to a specialist.
MFM, yeah, MFM and stuff.
I'm sorry, what is it called?
MFM, maternal fetal medicine. It's for high
Maternal.
risk pregnancies.
Okay,
Well, you
yes.
probably did the bladder scans and the measurements and stuff like
Yep.
that. Yep.
We did a bladder scan, and then after we've done that, they refer us to one more doctor at Yale New Haven. So I'm here in Connecticut. I think you're in Boston.
Yes.
Okay. So my wife is actually from Boston, by the way. She's from Mattapan. I guess they used to
That's
call it murder.
crazy. I'm from Dorchester. Mattapan's like
Yeah,
next door neighbor.
yeah. What's the big street? Something Hill, Blue
Blue Hill
Hill,
Ave,
Blue Hill Ave. Yeah, that's the street that she always takes me down and get some good food. So
the Forever
uh,
Road.
yes, yes. I always get lit. It's pretty popping out there though. But so we get referred to this next doctor in Yale New Haven. Now, when we go to this doctor, after we've seen the doctor in Bridgeport Hospital, doctor in Bridgeport Hospital is kind of basically telling us what it is. I'm still not at a place yet where I'm learning the ultimate fate of my child.
Hmm.
Hey, it's just we got to do more scans. I'm gonna refer you to here. We got to do this. We got to check this, and we're seeing this. Okay. Then when we get to Yale New Haven, this is kind of like the D-Day for me, and this is where I broke down crying. Okay. First of all, and I don't know if you had to do this. Um, they they pulled us in. They actually wanted to take some blood from the belly or something like that from my
The
wife.
fluid, the amniotic
Yes,
fluid.
they
Yes.
wanted to
It
take
was
that.
I forget what it's called, where they put the needle in to test
Yes,
the urine from the placenta.
and it looked absolutely painful to watch. It looked like it's one of those things where you're just like, what is happening right now? What is
You're just
happening?
cringing in your
You're just
skin.
cringing, and you
Hmm.
just feel completely out of control. And then I just remember, we 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 did that scan, and then they wanted to go do more blood work, and then they're just testing, and they're like, okay, we're sitting in a room, and they're like, okay, the doctor's gonna come see you. When the doctor comes in, there's at least like three. There was like three of them that came in, and they didn't look specifically. Hello,
Okay.
nice to meet you.
Go ahead, go play with Dada. Go get your butt change. You're welcome. Sorry.
That's okay. These doctors didn't specifically look like they had a lot of. They weren't coming in with good news. Right? They were kind of like looking kind of down, and then it was just like they kind of all sit around you, and you're just like, what is going on? And then they tell us that our son Jeremiah, um, it's he is. There is a term for cardio failure.
Hmm.
I forgot the name of the term, but what was happening is his bladder was pushing up so high on his other organs where really it wasn't the urinary tract obstruction itself that was going to kill him. It was the impact to his kidneys and to his
Hmm.
heart. And they said that when they said, we don't think he's going to live another 2 weeks, that's when I just broke down and cried, and I just felt like It's like literally going from the highest to the high, and you're just getting pushed straight to the bottom
Mhm.
without clear reason or information as to why. So when they told us that, I wasn't I my immediate thought is what can we do? Right? And they're like not much because he's suffering from a heart condition. And in my the where I was mentally is I don't want to accept the answer, so I'm like, okay, we're going to get second opinions.
You're a parent. You're gonna fight and do anything you need to do for your baby.
I was ready. I was ready. So they're telling me, all these things. And then, like, one nurse came to me and was like, if you'd like, we can do a scan. Sorry, we can do a scan and then record the baby's heart beating and give it to you in the bear. And I'm just like, no, I'm not, I'm done here. What are you talking about? You're ready to bury my
Fighting
child.
for the end.
Yeah, like, no, we can keep that for right now. So I remember we called our primary doctor, Dr. Dusa, and we were discussing what we heard with him. And the good thing is my wife is like a crunchy mom, and she's kind of like she likes to do research. She already started doing research on CHOPS in Philadelphia.
Yeah, I heard about them too.
Amazing hospital, by the way. And we called them as soon as we got home, and they were like, we're gonna call you back. They called me back that same day. Now we're talking about a Friday. They called me back on that Friday and said, can you guys be here for Monday and pack for like an extended stay? So at that point, I was like, we're gonna win. I was like, it's good. So we spent the weekend. We packed everything. I had to drop off my dogs, etc., get everything squared away, and I took that week off from work. All right, so we're in Philly. By the grace of God, I got a train from Connecticut to Philadelphia for $20. My brother works for the hotel, so he was able to take care of my hotel. So it was really no expense to me to get down there, right? So then we get to Philly, we go see the doctor, and like my heart is racing. I'm nervous, I'm anxious, I'm excited. We get there, you just don't feel like anything is gonna be wrong.
Hmm.
They do more tests on my wife from like 7 a.m. to about 9 a.m. Then they take a break. They say, hey, we got to review everything, talk to the doctors. We'll go get lunch. They call us back. It's like, I'm not even hungry. I'm just like, just so numb, just kind of like, you just feel like I just want to know. Like, so there's no
Hmm.
hunger. There's no feeling. You're not really sad. I just
You
want to
have
know.
no emotion
You
at
have
that
no
moment.
emotions. So I, we come back and there's like now it's like the big doctor, this woman, she's like the head of the whole department, and she comes to sit with us. She says, listen, like, there's nothing that can be done at this point, even if, and like I start crying again, and like, and I it's hard. Like the doctors are like, I get they're trying to be as empathetic as possible, but it's not
You don't
gonna
feel it. You
it's
don't
not
feel
gonna
it.
feel, because like you're saying to me, well, like, even if he was to survive this, right, what kind of quality of life would he have? And again, I'm thinking about I don't care if I've got to like carry my child in a wheelchair for the rest of my, I got that is irrelevant to me. I'm not
Hmm.
looking at like I need a perfect human being. I want this human being.
Hmm.
And they're saying, well, like, he's gonna have dialysis, he's gonna have to have transplants, he's gonna be on medication. It's gonna be a really, really hard life for him. And I'm just like, you don't know me. Like, I
Hmm.
I don't like that's your definition of a hard life. That might be yours, and I respect
Stand
it.
in my shoes
Right.
and then tell me a hard life. I grew up from same perspective as you,
Mm-hmm.
so we're fighters and we're not gonna stop.
Right.
We're not gonna let whatever happened to us growing up, or we're gonna be different. Like I said to my husband, we need to set better goals so we don't bring generational curses onto our kids.
Yeah.
And we're gonna fight, just like how you would fight.
You gotta fight. Absolutely. So I was hurt. I was really hurt, and they told me about 2 weeks left. Now this is, it's like as if the pain is not enough. You got to take. There's the next one, which I know, which is the DNC. I remember coming home. So let's say we went there and we were there until like Tuesday. Our doctor, we told him what happened. He wanted to see us that Wednesday and then again on that Friday, right? So it's like, okay, we're leaving Philly on Tuesday. On Wednesday, doctor wants to see us. We go and see him. He does a scan. Jeremiah's still in the womb and happy and healthy. So I'm starting to get new hope again because the doctor's like, well, there is a chance that the tissue maybe folds or breaks down and he's able to urinate. So I'm like, let's go. We still got a chance. I remember leaving the visit and I said, I'm gonna do a fast. I'm gonna do a fast. I'm not gonna have any alcohol. I'm not gonna have anything bad. I'm just gonna be in prayer and fasting, right? We go out to dinner on that Thursday. And then on that Friday, we go back in for another visit. When we went back in on that Friday, the nurse was like, okay, can you come and hold your wife for a second? And she goes like, I'm sorry to tell you, your baby has passed. She says that she did a measurement. There's no heartbeat and his body's already starting to shrink. So that's when it was like, okay, that's it. Then they want to go ahead and schedule the DNC. The worst part about this and the part that I'm still dealing with today is my son died on that Friday. That Sunday was Mother's Day. The DNC was scheduled for that Tuesday. So it was just one of the toughest seasons of my life that I've ever had to go through. And it's something that I wouldn't wish on anybody. And going through that, and not only that, I think the icing on the cake was we weren't even able to see our son after he was taken from my wife. And this is where I really want to also educate people on because sometimes they'll be they'll be quick to try to take what's remaining of your fetus baby to try and do research and not even giving you the chance to say your final goodbyes or just take a moment to kind of mourn what just happened. So when we're done at our discussion, I do want to kind of conclude and just give dads and parents who will see this, who are going through this, some awareness of like, after you go through this journey, here are some things, or as you go through this journey, like if you are coming home from your week 13 scan and you're like me, like, oh my gosh, like, what do we do? I hope they see this video and they're like, okay, here are the next things to expect. How do we want to navigate that? So I'm going to pause on my side because I think I've shared enough and I want to make sure you have good time for you to share your story because you are the guest here and I should have made sure you eaten first, but I also wanted to give you a context of who I was. Since our first time meeting.
No, it's good. So I have PCOS. I don't know if you know what that means. Polycystic ovarian syndrome.
Okay.
So it's where women don't get their periods all the time, or they have more testosterone or cyst on the ovaries. So that's what
Hmm.
I have. So I have to take a medication to make me ovulate to get
Okay.
pregnant.
Okay.
So my daughter, I got pregnant the first round. With my son, it took 3 or 4 rounds. I found out when I was pregnant at 3 weeks,
Question
very
for you.
early.
When you say rounds, is that like so is it like
It's
a pill?
pills. Yeah.
Okay.
So I would have to take one pill for 5 days
Okay.
after on day 3 of my period, and it's supposed to help you ovulate. So my daughter was the one who kept telling me, "Mommy, baby's coming, baby's coming." So I'm like, I'm brushing it off. My period's not due. I'm not really worried about what she's saying. She's a baby. April 1st of 2025, she woke up on top of me, grabbed my cheeks, and said, "Mommy, baby's coming." I was like, "Well, my period's due today. Let's just go with the flow." My husband went and bought a pregnancy test. April Fools, there I'm pregnant.
3 weeks in.
Um, I went into the hospital at roughly 7 weeks because I'm Rh negative blood type. And women that are Rh negative, our bodies attack the babies like they're a virus, a sickness. So we
Oh.
had to get an injection called the Rogram shot. So I had went to the hospital, they found the fetal pole, they seen the heartbeat, they gave me the Rogram shot. They had me touch base with my OB. We went in at 9 weeks. We did another scan. The baby was growing. There was no problems. By week 11, I started getting really bad morning sickness to the point where I wasn't holding down anything and I was dehydrated. So I had went to the emergency room
Yeah.
to get fluids, and get evaluated. And that's the ultrasound where we seen the extended bladder. But
Mm.
the way that they explained it, at first they didn't want to show me the screen. So that kind of bothered me and that kind of gave me like a little like, what are you trying to hide from me? It's my baby. Why can't I see?
Question for you. So you're is it like, I guess from me and my doctor, it's kind of like a flat screen TV on the wall and you're kind of
Yeah,
like on the
so on
bed?
the little cart thingy.
Yeah, yeah.
So usually they have it to an angle where, the mother and father can see, but they could also, do the ultrasound. So she's like, I can't show you. So I asked to speak to the manager of the ultrasound department. And she came in and I explained to her, like, why can't I see my baby? Like, something's gave me red flags. So she's like, okay, she showed me. They didn't say nothing.
Hmm.
So I read my discharge paper. It said the baby had an extended bladder. So I followed up with my OB. So technically, my OB's office, they didn't really want to keep me as a patient because from what they said, is they don't have the right equipment or knowledge to basically guide me through the pregnancy, track him. So by week 14, I was in the process of transferring to Mass General Hospital because they say it's not genetics, but I'm telling you right now, I think it's genetics
So you think
because
Ludo, you think
it's
in your
genetics.
case Ludo is genetics, or you think in general Ludo
I
is
think
genetics?
in general,
Mm,
because my daughter was born with kidney issues.
mm,
I didn't find out until she was 3 weeks old when she went septic and they
mm,
told us she had kidney reflux. The kidneys and the bladder work together.
mm.
So I'm thinking, but I'm not a scientist. I can't say that. So
Sure. Well, the
I
scientists can't
don't
figure
know.
it out either. So,
I
so
don't
you're
know.
fine. The scientists can't figure it
So
out either. So you're fine.
so I was like, was it me? Is it like genetics? Is it because my daughter has something?
Mm,
So the reason why I went to Mass General is so that the baby could be followed by the urologist and the nephrologist that my daughter had seen when she had her surgery and stuff.
mm-hmm,
And they were wonderful. Um, they had me coming in every week to do a scan of his bladder to see if it's shrinking, if it's getting bigger, and it just kept getting bigger and bigger and bigger. Um, the last scan, it was almost 3 milliliters, I believe it was, or centimeters. Um, they had sent me into, what is it, South Shore Hospital to meet with the maternal fetal medicine doctor to do a more in-depth ultrasound. That appointment, it kind of hurt me the most because all she said is terminate the pregnancy. And I said to her, I said, but if you don't know what's wrong with my child, what makes you think that you're God? Like, yes, there is cases where Luto, where most babies or a certain percent of the babies with Luto don't have as many complications as others.
right.
And that's what I found in my research because nobody was telling me anything. I came home, I was on Google. My husband's like, stop looking at Google. You're scaring yourself, like, let's just go with the flow. And I went back, I believe a week later for another MFM.
Mm,
She said that his bladder did grow a little bit more. Um, Again, pushed me to terminate pregnancy right then and there. And I went home. I had a conversation with my husband and I said to him, I said, what are we doing? Because at the end of the day, it's not just my choice or his
Mm,
choice, it's both of our choices.
mm,
So basically, we both decided we're not terminating pregnancy because who am I to kill a baby that has a heartbeat? You
yeah.
know, who can predict the future, you know?
Mhm.
So I told the doctor, I said, you know what? You guys keep saying terminate my pregnancy. I'm going to put it in God's hands.
There you
And if
go.
God wants to take my son, he will take him that way.
Preach.
I am not terminating my baby.
Yes.
Um, moving forward like 2 or 3 weeks after that, I was 19 weeks
Yep.
and 5 days, 6 weeks. I was just about 20 weeks. The urologist and the nephrologist told me that the cutoff line to put a shunt in is 22 weeks, I believe. I
Right.
was just at the 20 week.
Right.
The ultrasound that we went to, our very last one, was for them to check his kidney function to make sure that they were functioning and his kidneys weren't failing.
Right.
And that's when we were told that he had no heartbeat. I didn't react the way that I thought I was gonna react,
Mm.
because I had my daughter there and she's autistic, so I didn't want her to feel my emotions and get worried herself.
Yeah.
So I had them scan like 3 or 4 more times just to
Yeah.
give me a peace of mind. Like, are you scanning the right place? You
Sure.
know, are you in the wrong spot? And he broke it down and he's like, you see the color pattern? And I said, yes. He said, you see how there's no pattern of color right here? He goes, that means there's no heartbeat.
Mm.
So 3 days after that, so June 25th of 25, I
Can
was
I ask a
told,
can I ask a question or make a statement?
yes.
I almost wonder if there's like a woman's intuition that happens because when you say to me, I didn't like, I don't know, maybe it's the husbands that get more broken up over this. My wife had that same like reaction. Like it's kind I don't want to say it's like okay. Like it's not
You
like
want to know what it is?
yeah.
It's a mother. Any mother is going to do that. Any mother's going to, like, anyone that real, because I know people, there's things that happen, people have abortions and stuff,
Yeah.
but any mother that wants that baby is going to fight for that baby. You can tell me that my baby is going to die in 2 weeks, and that's what they told me, and I made it to almost 21 weeks. They told
Mm,
me I wasn't going to make it past 15 weeks.
right.
And the thing that hurts the most is after we left the hospital, obviously we came home, we cried, but we did it without my daughter being around. And it's weird because she said to me,
Mm,
she goes, Mommy, it's okay. And she just started talking. She goes, Mommy, baby brother is okay. And I think that was him trying to communicate in another person, like, I'm okay, I'm fine. Yes, you're sad that I'm gone, but 2 days after they told me he had no heartbeat, I had went to the hospital to deliver him. I didn't do a DNC. I had a vaginal birth. Um, I did no type of pain medication, no nothing. They were trying to force me to do a DNC. Um, but then one of the other doctors came in and they were like, "Well, he was measuring bigger than what his gestational stage was. She can't have a vaginal birth if she wants to. That's her decision." So I went in at 340.
question for you. What is
Yes.
this like what is this desire by these doctors to do a DNC? Like why do these doctors
Quick and
force these
easy.
women quick
Quick
and
and
easy?
easy.
Boom.
That's a better answer.
C-section. Like
So
that's
my
all.
daughter, she was a C-section, but it wasn't because they were trying to, like, she was breached the last 22 weeks
Oh,
of
okay,
my
okay, okay.
pregnancy.
Okay.
And they did an aversion where they flipped her, but
Mm,
she flipped right back around. And when she
mm,
flipped back around, the cord went around her neck. So they had to do a C-section. But
mm, mm.
when I delivered my son, I didn't do Pitocin to induce labor. They just gave me pills inside of me. They did that twice, so every 3 hours they did it. So 2 times 6 hours. I delivered him at 11:12 p.m. And it was it was scary because I delivered him on my own. Nobody was in the room with me, just my husband. And he's like, "What? The baby's here? What?" Like he was like in shock. Like it just happened so quick. Um,
There was no midwife, no doula, no nurse.
Nobody. So I'm gonna be honest. My contractions were so bad. They were like seconds apart. And I looked to my husband. I said, "Excuse my French. I don't know if you want to beep it out." I said, "I can't fucking do this anymore." I said, "Just give me an epidural." The doctor just walked out the door to go find the anesthesiologist. And I looked at my husband. I said, "He's coming. Press the button and tell him to come in." He goes, "What do you mean?" I said, "Just press the button." And I delivered him on the bed by myself. And I didn't get to see him right away because they had to give me a medicine through my IV. It was like anesthesia. I was awake. I could hear everything. It's just I couldn't really see anything because there was a little piece of membrane left. So they did bedside surgery. That didn't work. They had to rush me to the OR to do an emergency DNC. And the only thing that really hurt me was the day we went into the hospital to deliver him. I don't know. They gave me a memorial box. It had his whole name on it, like his first blanket, the holy water that we blessed him with, the pregnancy test, the gender reveal balloons, like everything you would put inside of the memorial box. They had it sitting on the front desk of the hospital when I was coming in to deliver him, which I thought that was disrespectful. Knowing the circumstances of any woman coming in to deliver a baby, whether it was a miscarriage or a stillbirth, for them to do that. So me and my husband's like anxiety and emotional level was like up to
It's kind of
like
like you're walking
over a
into a
hundred.
funeral.
Yes. Um, they basically kick you right out after you deliver the baby too. So it was like I would say 12 hours after, not even, because I had him at 11:12. I was discharged from the hospital at 12:30 the next day. Um, and that's just where it just all it hit more reality when we had to go to a funeral home. When we had to sign papers and like you have to basically sign your kid's body over. And that was another traumatic thing that they did is we all know what a body bag looks like. They told me I could spend as much time as I wanted to with him. We spent the whole night with him. And my husband didn't want. I don't know if you felt like this way or you would feel this way if you had the same situation as me. He didn't want to hold the baby in front of me. He wanted his own quality time where he could just let out his emotions because guys don't like to show their emotions.
I can tell
And
you, uh, it's it's hard because you're it's not because your husband doesn't feel like he can be vulnerable around you. It's not because of anything. It's because
the
as a man
strongness.
and that you have to hold a position of strength for your partner.
And I told him, I said, because the nurses came in, do you guys want us to take him and bring him down to the morgue? That's exactly what they said. And I looked at him and I said, do you want to spend your time with him? And he said, yes. Um, that morning when we woke up, when the nurse came in, I asked her if she can take him down because obviously the baby's no longer with us and they start decomposing. And I started seeing more of that happening. And I wanted him to be, preserved to get him cremated and have him come home with us. So when she came in with a little body bag, and put him in it right there in front of me. And that's when I lost it. Like, you would think that they would push the baby out in the little bed and go into a separate room.
It was a little bit. It should have been a way more dignified than just.
Yes. If it was a family member, they would never did that. Go ahead, go out there. Um, that's the part that hurt the most. And as the days went on, it didn't feel. Jordan. How do you keep going in yourself? So after we left the hospital, it's like we left without a baby and we're seeing everybody else leave with their baby. And it's like, I don't know if you've experienced it or anybody that's going to watch this have family members or friends cut you off because they're pregnant. And it's like, don't do that. Like, I'm not upset that you're pregnant. I'm happy. When I cry or express my feelings, it's because I'm thinking about that could have been me. That could have been where I'm at. And that's another thing with loss,
Yeah,
especially when it comes to babies. Like, how could people that are there for you during the whole pregnancy and then you find out something bad and you don't have anybody, you have just you and your partner, or if you even have a partner, and it's just like
yeah. That's exactly how it
it's
was. You know, when we lost Jeremiah, it was like I was in a season where I had the same thing. Everybody's having babies around this time or just had a baby. And I feel like I try to be you find yourself, I don't know if your husband did this or even if you did this, but you put yourself in a position sometimes where you're trying to be stronger for other people. Meaning like they don't know how to necessarily give you the empathy and the grace and
hmm
love that you need. And sometimes it may come off so it's like, you know what? I'm just gonna be strong because the energy I need is I'm not getting and I don't want that what you're giving me. So
hmm
what's in the most polite and loving way possible, you you just take a place of strength and you just say, "Hey, I'm gonna get through it. We're gonna get through it. We'll be fine." But really inside, you're like,
it's
"What?"
eating you up.
Yeah.
It makes you feel sick to your stomach.
And sometimes people, it's almost like, and I don't know if you guys went through this, but it's almost like they're going through. I don't want to say they're going through it more than you, but they're not. They're worried about their own emotions so much, where it's like it's actually putting more of a burden on me than supporting me. So the support system, I agree with you. It when you lose a baby, it's not that I don't want to say you find out who your friends really are. It's just that I think that people don't intuitively know the best way to support someone when they've had a loss because a loss is more of a rare thing. But it's like it also feels like I think more so maybe for the women than men. I feel like women and you can tell me if you felt this, but like I think women go through like this level of shame where going to tell you maybe and I think my wife was super cautious, like she didn't really want to tell anybody we were pregnant until we were like really
Past
into
a
the
certain, yeah.
right. But then there were some people you did tell, like your mom, like your close
Close
circle.
people, yes.
So going back to those people to share with them and that baby's not coming, I think women feel ashamed as if like they are responsible for it. And I feel like that's another area that needs to be discussed or create an awareness of. Is like you didn't cause any of this. Nobody caused any of this. There's not intentional. It's not that you didn't do something right. It just happened. And I think that more women should understand that don't go through that period. Like, don't add shame on top of.
Force yourself. So I agree with you because after I had him, his name was Josiah. We named
Okay,
him
I
we
like that.
named him Josiah because if you look in the Bible, Josiah means God will heal.
Wow.
Once we found out about his bladder, we were like, you know what? We're gonna name him Josiah.
And we named ours Jeremiah after the Bible too.
Yeah. And it's like I want other parents, other mothers, other fathers to be aware, you know, every situation with Ludo is different.
Yes.
And what people like what you're doing is making awareness to parents, that are going through this. Like, do we want to go through this? Do we want to hurt ourselves? Let's look at other people's stories and see how it turns out. I would never wish this on my worst enemy
Same.
at all. And I just want other parents to be aware of, yes, there is a fatality that the baby's going to pass. Or yes, the baby's going to have to be born and have dialysis. Everything is different, but you have to vouch for yourself. You
Right.
have to speak up and say what you want and not what they want. Because if you were in my spot, they try to wean you into what they want.
Yes.
You need to speak up. That's your baby. If you
Yeah.
want to get a DNC, that's on you. That's what you want to do. Don't let nobody talk down to you about whatever decision you make.
Right. And
They told me I was crazy.
yeah. No, the funny thing, when I was surprised, because when you told me you delivered vaginally, I don't even think that was on the option on the table for us. And it makes sense because the doctor we had it, um, you know, I don't know if he was a big fan of vaginal births or not, but like, um, it's interesting you say that along with what you said before, which is, hey, DNC, boom, boom, and you're out the door, vaginal birth. We got to sit with you for about 8 hours. And then when you
Or
tell me,
longer. They told me I could have been there for 3 days to a week, and I was
but,
only there for one.
and they just left, you were like, you're just going to sit in this room by yourself, you and your
Yep.
husband. When the baby comes, let us know.
Mm-hmm.
So what I'm taking so far is they'll push you towards DNC because it's quick, fast, and easy. You do have options that you should advocate for.
Yes. So my thing was, is they were telling me that he was going to be too small. I don't know. You might have to edit it because of what I'm going to say, but like,
It's all good.
they were like, oh, he could be born and his head can get stuck in you, or he could be born and his limbs, from us trying to pull him out, are going to be separated. And she's like, she kept trying to force it on me. And I'm like, you know what? Like when they did the bedside surgery and then had to bring me to the OR to do a DNC to get the little piece of membrane, I'd rather do it my way. And if
Yeah,
it doesn't work my way, then we could do it your way.
right.
Because I was like, me and my husband were talking like, if we do a DNC, we're not going to be able to bring him home. We're not going to be able to see him. And that was
Mm,
my biggest thing, was I wanted to have something of my son other than a blanket with his outline of his blood stain of his body on it.
mm,
And I I just I don't know, I didn't want to do it the easy way.
mm.
No.
It's
I
hard.
just, like you said, we had a hard life coming up. I'm not taking it the easy way. I'm not gonna be a wimp. I'm gonna do this. And the nurses were like, you really gonna do this? Like, are you
Mm,
sure? The outcomes? And I'm like, you know what? Mama. Yes, baby. Go ahead, go eat your ice cream. And I just, after having him, I asked them, like, can this happen again? Like,
mm,
what are the chances this is gonna happen again? Like, and they were like, it's not gonna happen again. There's not a high percentage it could happen again because it's not genetics, as they say. Um, and I was like, you know what? I want to go to a fertility doctor.
mm,
So after I had him, September came of 2025. Me and my husband went through a fertility clinic at Mass General to, get genetic testing, get just to make sure it wasn't me. I wanted to get that clarification in my head. Like, Jillian, it wasn't you. It's
mm,
not your body. It had nothing to do with you.
mm.
And all of our genetics came back fine. Everything came back fine. And we're actually trying to have our rainbow baby this year. So
Yeah,
I got my fingers crossed, but I'm nervous.
good for you.
So,
Well, let me tell you this. So, if you read the Bible, and if you are familiar of the story of Job, Job actually, and this is where I was able to relate and get through on my side, right? what will be taken from you will be restored 2x. I lost Jeremiah. I've had 2 kids since him. One boy, completely healthy, no issues,
I'm so happy
super,
to hear that.
super happy, healthy. So I will let you know that it will be restored to you. Um,
That's my biggest fear.
yeah, it's
I know God got everything in his hands, but after experiencing something like that,
yeah,
you think good and you think bad, and you're in the middle because
yeah.
you don't want to be too happy and you don't want to be too sad. You just want to be, at a comfortable spot.
You
And
just staying focused, and you're
and
like,
it's funny that you say that because my daughter's been saying for the last 2 months, "Mommy, twins are coming. Mommy, twins are coming." And I told her, I said, "Don't start your crap right now because I
uh,
can't handle it right now." But
you know what's funny? When you do get pregnant again, it's gonna be some like there's gonna be something spiritual that happens in a sense. Like, okay, so when my son, his name is Maverick, when we got pregnant with him, I had friends like, hey, I had a dream that you guys were pregnant. I had a dream like
my
that.
sister,
What's that?
my sister just called me like 2 weeks ago and was like, "You're gonna get pregnant soon." I said, "What are you talking about? I'm so lost." She's like, "I had a dream last night that you're gonna have a healthy baby."
Yeah.
She goes, "I don't know the gender, but there was a blue blanket." And she said,
Mhm.
"It's gonna be soon." And she did that with my daughter too. So it's weird.
Yeah.
I don't know if you believe in the chakra.
What's that?
So like I can't I don't know how to describe it the right way, but it's like your brain, your
Mhm.
eyes, like
Oh,
your
like a
body. Yes,
balance, like an
the
energy.
chakra.
Got it.
Yes.
Yeah, yeah, yeah.
Always go with your gut.
Yes.
That's why when they told me to terminate him, I was like, no.
No, yeah. Absolutely not. And I'll tell you, like, we to add icing on the cake, right? And this is like my wife had fibroids, both on the inside and outside her uterus.
So that's kind of like PCOS in a way, yeah.
They wanted to cut her open to remove the fibroids, and my wife chose hard. She was able to reduce her fibroids by actually I think she did the Daniel fast and she changed her diet, and they
Hmm.
shrank right before. The funny thing about that is she did her fast as soon as the fast was over, because we're not being intimate during her fast.
Can you get her, please? Sorry.
It's all
She
good.
keeps
All
like,
good. I'm in the same boat. But as soon as her fast was over, the first time we were intimate, she got pregnant. It was not like planned or anything like that. And then that's when like the spiritual stuff started happening. Like friends and family are like, I'm having like weird dreams that you guys are gonna get pregnant, and like they're pinpointing it to down to like the conception date. Like I think it was like 3 weeks ago when I think she got, and it's like that's crazy. And then with Maverick, my wife, just started acting really weird and everything like that. It was like the same thing all over again. Here we go with the move, and I'm slow sometimes, so I'm just picking it up as like, okay, she's been in a funk. I'm not thinking like, oh,
now I'm thinking, now I see what's going on.
yeah. And it wasn't until Christmas, like, so we literally got conceived Jeremiah, lost him, did DNC, and then conceived another baby all in the same year. And I think when you lose your baby through LUTO, you kind of go through the grieving process, and then you go through that phase of, well, you kind of have that mental mind
Craving.
game of like, will we have a baby again? Our next baby. So that same thing happened to us. And then it's like, after losing the baby, then you're finding out, oh, here's another hurdle. By the way, you got these fibroids that I don't think you should have there while you're trying to get pregnant. And it's just like, ugh. Then they're like, hey, by the way, we got to cut you open. And it's like,
A roller coaster.
it's just like more and more stuff. And you're just like, oh my gosh, is it meant for, like, is it meant for us? And by the grace of God, like everything worked itself out. Fast forwarding after all of that, Maverick was born on time, healthy. We actually had 2 home births. we elected to hire a midwife, which I'll have another episode about, and a doula. The midwife has to be a nurse practitioner, and a doula, and do a home birth, and really, again, choose hard. And it's another testimony where I'm excited to share to and give mothers more insight of like, and mostly fathers, but mothers can also benefit too. Like, you have options. You always have options. Unfortunately, healthcare professionals are going to sometimes push you in the area that maybe favors them, but gives you some level of mutual benefit. But when it comes to telling you to do a D&C, when you have the option to do vaginal birth, and not even really like put it on the table and let you pick which one best. It's like, is that fair? Is that even right? You
And
know?
that's why I said to them, like, when they kept trying to force me to do a DNC, is like, if whatever you said might happen happens, it happens.
Mm,
Like, I wanted to go with the flow. I don't want anyone making decisions for myself.
right.
Unless it was like my husband or my mother, then I couldn't make that decision. You know what I mean? But advocate for yourself, reach out to whoever, don't wait on your doctors. That's one of
Yeah.
the things I can say. And I think that's what kind of hurt the most, was because once I knew and I seen that on the screen, I
Mm,
contacted her urologist and her urologist to have them, do my scans, because that scan, when they told me he had no heartbeat, was to determine to do his surgery a week
mm,
after that to put the shunt
hmm.
in.
Yep. Yep.
And I've learned a lot from that pregnancy. So basically, why most people are finding out their babies have LUTO at 12 weeks is because at 12 weeks, a woman does not need progesterone to keep the pregnancy. The
Mm,
progesterone is what builds the sac of
mm-hmm.
fluid.
Mm-hmm.
After 12 weeks is when the baby starts
Yeah.
urinating to build the urine in the sac to have fluid.
I see.
And I don't know if it was a coincidence because, like I told you, 7 weeks I started bleeding, but that was because of my blood type. But at
Yeah.
9, 10 weeks, I noticed my progesterone levels were dropping down a little bit. And now that I think back, I think that God was trying to take him earlier than what I let
Mm,
him, because I had to take progesterone pills until 12 weeks
mm,
to keep and sustain the pregnancy.
mm,
So there's a lot of things I've actually learned with all of this, and it's crazy that they don't have a lot of research on it.
mm.
And it's like, obviously this stuff is happening a lot more frequently than years ago.
Yeah.
So they should start putting in some type of research, because I personally, I'm not a scientist, I'm not anything like that, but from going through what I did with my daughter and then Josiah having something similar, it just rang in my head because I was scrolling through Facebook in that LUTO page where I had found your link about what we're doing now. I was like, hold on. You know how they have the suggestions for other groups?
Yeah.
The name of the kidney issue my daughter has popped up as a suggestion on the LUTO page.
Wild.
So I'm like, and I said to my husband, I'm putting two and two together. And I'm the type of person I'm trying to find out answers, and I'm going to find out answers some way and somehow. I honestly think it is a genetic thing.
Hmm.
And mark me if I'm wrong, but watch in the future, they're going to say it's a genetic thing.
I wouldn't be surprised um, if they say it was a genetic thing. Where I would be maybe frustrated is if you knew this all along and you
Just playing it like you don't.
just playing like you don't. That would be angering. But like if you did, because here's my thing, right? Like with even in my case, like you took my son away. I never even had a chance to say goodbye or anything like that. Um, and you wanted to do all these studies, study. Okay, at some point, right? You've had enough of a sample. Give
What
me
are you
some
doing now?
yeah, well, give me something, right? Fine, you are not able to prevent it, but what does care look like if you are diagnosed with this, right? And how are the parents supposed to adjust? And that part, I just feel like they need to do a better job at that, like a much better job. And I'm
And
hoping,
another thing is too is they need more education on it when parents find out that their baby has an enlarged bladder. Because how are you an OBGYN/doctor and all you can tell me is that the bladder's extended and we'll just check you in another 2 weeks?
that's
if
crazy.
if LUTO is out there, whether they are acknowledged to the LUTO or PUV is like LUTO too.
Mm-hmm.
So it's just like they didn't give me an exact thing what he had. They were putting it between LUTO and PUV.
Wow.
So I never got definite answers. And if I was to do an autopsy on him, it would have been $2,000 to do
Mm.
that. And I was like, you know what? I don't want to put him through that. I don't want to, like they
Yeah.
told me it's not genetics. I'm just going to go with the flow. But I think that whatever research you do, take it with a grain of salt
Mm-hmm.
because, like, every situation's different, like we said. And just prepare yourself. That's what I can say. Just prepare yourself
Mm-hmm.
for the good and bad
Mm-hmm.
when you find out that your baby has an enlarged bladder because
Mm-hmm.
you don't want to be too excited. You don't want to be too
Negative.
sad because we
Yeah.
don't know the outcome.
Right.
And I think there should be support groups other
Yep.
than that Ludo page,
Yep.
like a grievance counselor, but people that have gone through it.
Yeah.
There was a mother on the Ludo page, the Ludo Warriors page, that had a similar situation like me.
Mm-hmm.
Um, and we inboxed each other and we got each other both through things. Hers was a couple weeks after me. I was, what, 2 months before her. And we talked, like most parents that have lost their babies to miscarriages for whatever reasons don't come to talk about it. And I think that's the part where women and the men are just like let go and
Yeah.
they don't know how to grieve properly because they can't express their feelings. They can't tell other people because they don't, like you said, we feel like it's our fault.
Right.
And there's a lot of women that think it's their fault when it's not. And they should be able to express that, whether you get judged or not, because obviously there's people that judge, and we need to come together as a community to help uplift people, give them every aspect of the stories that we can so they could have some type of point of view of what they might go through. I was just dropped. Nobody reached out to me after I had him. Nobody, nothing.
That's so tough. It's so tough, and I'm in the same boat. I'm in the very very same boat, and there is no. It's like, and not only that, and it's not. I don't. I don't blame this on anyone but I think that the number of parents going through Ludo is significantly higher than what we see online. It's
Yep.
just that when you go and do the research and you look for that community and you see it's not there, you kind of just turn away and go the other way, right? You're
Hmm.
just like, well, I guess they're not here, so I'm just gonna go and
I guess I don't have anyone that I could relate to or
right,
understands my feelings or what I'm going through.
right,
Because, yes, a miscarriage is very devastating, but when you know that that possibility is on the table without it just happening, is more devastating because they're telling you in your face, like your baby's gonna die, or there's a very high chance your baby's gonna pass away.
right.
Other than, naturally having a miscarriage. And it's just like that's ringing in the back of your head for all them weeks. it was in the back of my head for almost 12 weeks. And
Right.
it's just like, how am I going to get through this? Like, I'm trying to stay as positive as possible, but I keep getting all these negative appointments. And it's like, you have so much hope that's not there. And then when it happens, it's just like your whole world just comes crashing down. And I felt
Mhm.
like I was trapped in a box and I couldn't come out. Like, it took me 3 weeks to tell anybody that I lost him.
Wow.
I didn't, my mom was the only one that actually knew because I needed somebody to watch my daughter. And I, when I did put it out there, everybody was surprised, and nobody knows exactly why he passed away, because I don't, there's a lot of judgmental people,
Yeah.
especially family,
Yeah.
and I don't need that.
Right.
Like, it wasn't me, it's not my son's fault. It happened.
Right.
And it grief is, it doesn't go away.
Hmm.
Things time as time goes, it does get better,
Hmm.
but it's always going to be there. And I know I'm only 7 months out from losing Josiah. You said 3 years since he passed away.
3 years, but you think about
All the time.
yeah, like especially the due date, right? And ironically, the funny thing about the due date is, my daughter was, it's like, it's, and when I tell you, Julian, like, when I tell you you're going to be restored, I'm telling you, like, don't be surprised if your next baby has the same due date.
And you're
As,
kind of scaring me because that's what the doctors told me. My son was due December 6th.
yeah. So don't be surprised if your next. Now, I'm just telling you, look, I lost my first son. My firstborn child
Was a
was a boy.
boy.
Okay.
You're
My,
giving me hope.
my secondborn was a girl. My secondborn was born. Listen, my firstborn was conceived after we intentionally did a fast, without like, and being intentional about, like, hey, we gotta shoot for a baby right now.
Just
Babies,
being nonchalant. That's
just
all.
being nonchalant. Boom, baby conceived. Baby number two conceived around the same time as Jeremiah and was born when Jeremiah was supposed to be born.
And it's crazy that you say that because my lucky number 7. And since Josiah has passed away, I've seen nothing but license plates with 777, or it's just randomly like songs come on, just like it's okay.
Right.
I don't know if you know the song A New Day Has Come by Celine Dion.
I haven't heard that one, but I'm gonna check it out.
I think you will relate to it because if I can, you're going to relate to it. And I'm pretty sure when your wife hears it,
Hold on. I'm gonna write
she
I'm gonna write it down.
it describes everything we've went through pretty much. And that song came on the day we left the hospital when we were told that he had no heartbeat. It's Celine Dion, A New Day Has Come. And when you guys listen to it, you got to message me and tell me what you think of it, because that came on when I left the hospital, and it like it was sad, but it was uplifting.
Yeah.
Um, I don't know. Do you want to see the box that I was talking about?
Sure.
I don't know how to flip this, or if I can flip it. Hold on. I don't think I can, so I'm gonna just.
Josiah Edward.
Yep.
Wow.
This is the little box they gave me.
Okay.
They gave me his first hospital bracelet.
Oh wow.
Yeah. Like, they gave me this to put him in, but he was way too big to fit in that. There's supposed to be a hat and a blanket. It's sad. It's sad. And then especially when I had to sign like my son over to a funeral home, I think that's where like reality kicked in, walking into the funeral home and setting up arrangements and doing all that stuff. I think that's when reality hit because I came home thinking I was still pregnant. I felt movements, and I even told the doctor while they were doing the ultrasound. That's why I was like, "Can you please scan again? Because this is like really messing with my mind." Um, Let me see. 'Cause I could tell you exactly when they told me that his bladder was extended because this was just his bladder,
Hmm.
and they
Yeah.
told me that what is it called? The bladder layer, when it expands too much, it gets thin. But they
Hmm.
said that it was thick, the whiteness. It
Yeah.
was
Yeah.
so they told me there was nothing to worry about, but look at where we are.
Hmm.
But
If you had to say like if you had to say from a husband's perspective, like let's say you know you get the news like and this is not a knock on anybody because like as husbands we're trying to learn and understand, we may not have the knowledge, but like from your perspective, like what would be like the best course of action for a husband as in regards to like their partner, like
when the
if he
circumstances happen and stuff like that, like
yeah
how to
like
support each other,
yeah
honestly, you both have to be strong for each other. It's not just going to be linked on the mother.
mm,
It's both parents, you know. There, I'm going to be honest, after we lost our son, we bumped heads a little bit,
yeah
but that
I'm
was
with me.
because of grief.
Yeah.
And you have to make sure that you're communicating with your partner, letting
Mm,
them know, like, babe, I'm really hurting today. I miss our son. Or,
mm.
there are girls. We can't say it's just boys because it's very rare for girls to get it. My mom's friend, her daughter just lost her baby girl to LUTO.
Wow.
So she's been contacting me and asking me questions. So
Wow.
it does go to both genders, but it's more seen in males. Um,
Mm,
but anyone that's going through it in a relationship, they need to communicate. They need to be there for each other. It's not just a one-sided story.
yeah.
It's both sides. And if you see that your relationship is going downhill after losing your baby, seek counseling. That's what
Yeah.
I did. Seek counseling, couples counseling. Not that you're saying to yourself that you guys are bad,
Yeah.
but you need somebody in the middle to explain to you, it's not just you that's going through it, it's your husband going through it too. You
Right.
both are going through a hard time. You both don't know how to communicate with each other right now because obviously we did before. It's
Right.
just losing a child. From my experience, you have to communicate. You have to express what you're feeling.
Right.
Even though you did lose your child, don't lose that spark in your relationship.
Mm-hmm.
You got to keep it there, still, even if you have to do like dates at home and stuff,
Mm-hmm.
something to uplift you because it is very hard.
Mm,
And they should have counseling for couples after losing their babies because that's a traumatic thing both partners are going through. And
right.
especially if it's your first time going through something like that,
Mm-hmm.
you don't know how to react. You don't know how to communicate your feelings because you don't know how the other person's going to respond back to you. And you don't want a bad response back because then that's just going to shut you out
Right.
completely from expressing anything. And I wish they had groups where people that did lose their baby to Ludo, that we can come together.
Right.
The 1 year anniversary is coming up and I'm feeling depressed. Let me go talk to my other friends from Facebook, that
Yeah.
have experienced this. Like, what
Yeah.
did you do when your 1 year anniversary came up when you lost your baby. What did you guys do? Like, did you celebrate? Did you light a candle? Like,
Right.
give me your experiences. So when
Right.
I get to that point, I know how to handle my emotions and stuff like that and try to cope with
Hmm.
it as
Hmm.
best as possible.
Yeah.
So,
You know, you're right. Like there's no guidance on like, my son's birthday, or his I should say his anticipated delivery date comes and goes, and it's like, how do you mourn this person? How do you celebrate their life? One of the reasons why I'm also doing this is it's like I have been struggling to preserve like, I don't want to say struggling to preserve the memory, but I have been struggling to make sure that I continuously push my son forward even though he's not here. I badly want to, and I still have to. My kids are, my son is 2, my daughter is only like 3 or 4 months old, so it's like I can't really explain it to them the way I want to now. But my wife and I have a box with all of our ultrasounds, the pregnancy test, everything,
so
and
I could tell you from experience, do it.
yeah.
Wait till they get to a certain age. I still to this day haven't told my daughter that her brother passed away. And like I said, the day that I left the hospital to go pick her up, she said, Mommy, baby brother's okay. And I feel like that was him in her body, just her telling me out of him, like, Mommy, I'm okay, you know?
Hmm.
Yes, I know you're sad, but just keep it, like, don't give up. And it's like, I don't know how to describe it. It's just, everything happens for a reason.
Yeah.
You get signs, just go with it. And
Yeah. And God's gonna reassure you, right?
if I didn't have my daughter, I don't know where I would have been right now.
Mm.
If, he was my first.
Mm.
Um, she keeps me on my feet. We have a elephant with his first, so like you did, looking online to buy things for your baby and stuff like
Yeah.
that. I found the cutest little Wendy, and Sleeper said it was sage green. We bought him an elephant because elephants are like a sign of good,
Yeah.
like good things.
Hmm.
And we got him an elephant. We put his first outfit that we wanted to take him home in on, and we put the 2 crosses with his ashes on it. And she walks in the bedroom every day. Good morning, brother. And she'll kiss him. And it's like, does she really know what's going on? Or like you just think like, oh my God, like we didn't tell her. And she's just, Mommy, baby brother right there. Love you, baby brother. And it's just like, okay, so I don't have to say, your baby brother passed away. She's
Hmm.
already like comprehending it because obviously she's not rubbing my belly anymore or anything like that, seeing the baby move. And I don't know. It's just don't give up. That's all
Yeah.
I have to say is don't give up. Fight for
She,
what you want. That's
mm.
the only way you can do it.
She may have a spiritual connection with him.
She knew when I delivered him.
Yeah.
So the night that I delivered him, my mom texted me and she said, Your daughter just woke up like the exorcist out of her sleep and said, Is mommy okay?
Mm.
And when I looked back at the text after I delivered him, he was born at 11:12 p.m. My mom texted me at 11:10 p.m.
Mm.
So it's like I believe what she says
Mm.
because I'm like that. I'm very spiritually like I I don't know, I have like what do you call it? Deja vu.
Sure. Okay.
And it might not happen right then and there, but it happens when I
Mm.
see it.
Mm.
So I'm just hoping what she says is true. We
Hmm.
get our double rainbow baby.
Yeah.
What is the rainbow
It,
baby at all?
it can absolutely happen. I will tell you, prayer is everything. Like, okay, so here's the thing. You and I both prayed that God would take our child or deliver them full term, completely healthy.
Hmm.
I I haven't come across anyone personally, but I have heard stories about like the worst, which is you have to do the DNC, which is now you're doing what you really don't want to do, which is more of an abortion. I mean, the baby's still alive, but someone's
Yeah,
going in there
that's what
to
they wanted me to do. And
yeah.
I told them no.
And it's just like, it's funny to me, or it's not funny, but more ironic and more of a proof of God's favor that we both lost our son around the same time, and we were in a position where nobody has to make a decision that they will regret. I shouldn't say regret, but the decision that they don't want to make.
No,
We
you said it right. Regret, because that's what I was thinking.
mm,
I kept saying to my husband, should we do the DNC, not be able to get to see him,
mm,
and then go home and then we're sitting there beating ourselves up because we did something because they wanted us to do.
mm,
I just, anybody that's going through it, do what you want.
mm.
If the doctor's saying it's threatening your life, then that's when you need to listen. You know what I mean?
Sure.
But if it's not threatening your life, it's not hurting your body or killing you in any type of way, do what you want.
Mm-hmm.
You want to carry that pregnancy on until full term and see, or wherever you get to, do it.
Mm-hmm.
These doctors are not God. These doctors can't make wishes and predict things. They just say things that they've learned in school.
Mm-hmm.
The only person that determines how life goes is the man above.
Amen.
And that's all I kept saying. You know, he brought this baby here. I have fertility problems. He brought him here.
Yeah.
He brought him here for a reason, whether
Yep.
it was going to turn out the way it did or for the better. He did that.
Mm.
Whether my son was here for 3 months to 5 months, or he made that entrance, and
Wow.
I can't get mad. I
No.
was beating myself up for the most longest time, and I just, now that I'm still grieving, but not as bad as I was, like
Sure.
depressed, crying all the time, staying in the house, not like isolating myself from outside world.
Mm.
I don't know. I want
Mm.
other people to be aware of postpartum depression.
Oh, we didn't even cover that part. We didn't even get
Postpartum
there.
depression.
We didn't even get there. Yeah.
They don't help you after,
Right. Oh,
especially even though it's a miscarriage
let me. And
or stillborn.
how about the fact that it's not even just that. Now, you, in your case, you delivered a baby. You pretty much delivered a baby, like, right? I don't even know if your employer or insurance consider this like a
FMLA type thing.
FMLA eligible, meaning like you would get your full paternity maternity leave. But I
My
can,
husband didn't.
yeah, I didn't either. Right? This, I mean,
And it's
this is
stupid. Even though my child passed away, I should still be able to use that because it's
yep,
family paid leave.
right,
This is a family traumatic issue. Regardless if the baby made it or not,
right,
it should be eligible for
right,
that type of stuff, and they don't.
right. I have heard it referred to, and I think they got really creative with the words, which is called family bonding time.
Yep.
So you're calling it family bonding
But
because
they
you,
changed it because it was FMLA.
yep,
Now it's FB something.
yeah. So what you're doing is you're excluding a whole group of moms who may have had an unfortunate circumstance and they've had
Mhm.
lost their baby. So, and I feel like that's another thing I want
On
to get
top of postpartum.
on top of postpartum. I would love to get back with you on that and talk to you even deeper about that because like in the same thing, it's like, okay, deliver go through what you got to go through, but like you're gonna it's basically like you're going to have a surgery or you're going to just take a couple of days off from work to take care of your health, and like it's
It's
not
your mental, like your mental,
right,
your physical. It's not just, I
right,
know it's just, I know women experience it physically because they are the ones that give birth, but fathers do too because you have two children now, three, including Jeremiah.
right,
You were in tuned when your
right.
wife wanted, you had cravings, didn't you? You had food
Oh
cravings?
yeah,
Any type of weird cravings?
oh yeah. Listen, I was going to get milkshakes at 3 a.m. Okay, so
So
like
that's what people need to understand. When couples are together and they're intimate, your body codes lock in with each other.
Mm.
So that's how you know that your wife's upset and not her physically telling you she's upset, but you're like,
You
oh,
feel it.
she had a rough day at work. I know she did, babe, what's up?
Yeah.
You're in tuned.
Yeah.
Men go through the miscarriages as women do. It might not be as bad as our postpartum because of all the
Yeah.
hormones, but
Right.
men go through depression.
Yep.
Men men sit there and exclude themselves from the outside world.
Yep.
My husband did it. We were both locked in the house for almost 2 months straight because we didn't know how to go out in the outside world and explain to people that I'm not pregnant no more, like
And that is the toughest part, right? When like people know you're pregnant, you haven't told them, they go, "How's the baby?" Or
that's what
"How's the," and that is
you
like,
have to tell them right then and there, the icebreaker, the baby passed away.
baby passed away. Yeah.
And then
It,
that brings everything back, and then you're just thinking of that day, and
mm,
it doesn't stop.
yeah. And
Like,
I remember when I even I think it's like I remember too. Like I got my brother. I was super excited. I got my brother like world's greatest uncle cup, and I got my and it's like I remember I gave him like a bottle of rum, and I was like, "Here you go. I got you this bottle of rum, and this congratulations, you're gonna be an uncle." And it's
mhm,
just like to tell, go back and I don't
have to
want the
tell them the bad news.
bad news. It's tough. It is so tough, and I actually, with my wife, I had to go back to work. My mother in law luckily was able to kind of be there for my wife, and but I had to go back to work because it was just like there's no category
Income and
for
all that stuff going on.
what there's no like okay, it's like they're like, do you want bereavement? Like it's like, well,
It's only
yes,
2 days
but like I need more
at
than that.
mass.
Yeah.
They only gave him 2 days at work, but it's
Wow.
paid. And I'm like, you just lost somebody you barely even got to know.
You lost your child.
Right.
You know, I so there's not a lot of and I'm so glad you touched on this because this is a whole nother thing that I will definitely love to bring you back on because I am going to have people here to talk about like the postpartum depression, but like you still have to go like it's like
Go about your day.
you have to go about your but you still have to go through that season of postpartum.
Mhm.
Like there is no like, oh well, baby didn't come, so maybe no, it you still got to go through it.
Nope. And especially if you go through postpartum and you have other children at home, including the new baby, it's hard because that other little human being that's there, toddler or whatever,
Yeah.
they can't they can't cook for themselves. They can't change their diapers.
Yeah.
Yes, you have your spouse, but it's like postpartum messes with your brain
It does. It
really
does.
bad. Some people don't get it, which I wish that was me, but it is hard and it's not spoken about at all.
No. That is something I'm also looking to talk more about on my podcast too is postpartum because for dads like you know like my wife is still my wife is still dealing with postpartum now, so it's like I am sometimes it feels like you're walking on eggshells. Sometimes it's like you feel like who is this person, the brain fog, the switch, like all of that, and it doesn't paint itself clearly as, oh, I'm postpartum and I'm here, I'm affecting all of this. It
so
paints itself as something's wrong, like what's going on with my wife,
so
like you don't know.
postpartum, I'm gonna be honest with you, kind of reminds me of like depression, but in a 10 times boost.
Mm,
Because you got to think, when a woman has a baby, they obviously are pumping blood for that other baby. Then they have all these hormones going through their body. Once that baby comes out, your body's like, holy crap. They're like bouncing everywhere, and like you don't know, like you're happy, but then you're mad, and you don't know why you're mad because you're happy, and then it's like, what the hell's going on with me? Am I okay? Like,
right,
I don't
right.
mean to lash out on you, but I'm happy. but I'm mad.
Yeah,
And it's just
and
like bipolar type thing. And
it
it's just
is.
like,
I had a
yeah.
moment where I looked at my wife dead in her eye, and I'm saying, why why are you struggling to talk nicely to me? And I'm just looking her in her eye, and her eyes kind of like watered up, and it was
Hmm.
almost, I it's the first time I realized something some
Something's wrong.
she's trapped,
Yeah, like something's going on.
because it was like her eyes watering. It was like she wanted to say or
Tell you.
but she something was like, no, you can't. And it hurt me. That's when like my heart kind of exploded. It hurt me to see that, because it's like, wait a minute. I'm thinking like a logical
I can
man.
answer your question. I know exactly what you're asking.
What's that?
So, the reason why women don't like to say that they're going through postpartum, because you see the news. Woman that, well, you're not out here, but a woman in Massachusetts, she killed her 3 kids.
Mm,
She just had a baby, 6 months old. She had bad postpartum.
mm,
Postpartum is, me as a woman, if I told somebody I had postpartum, I feel like I'm downing myself. I
why?
feel like, I feel like I know other women feel this way because postpartum, some people don't actually know what it does to the mind, the body,
Mm,
and some, I could say as me, I wouldn't know how to explain that to somebody because when I had my daughter, my grandmother used to always throw it in my face. Oh, you're going through postpartum. You need to go talk to somebody.
mm,
Like a harsh way instead of
mm.
being like, are you okay? Like, it made me feel like I wasn't normal. Like, I wasn't a mom. I was like
I see.
emotional wreck because I was always crying. It wasn't like everything would make me cry. You can tell me the sky's gray and I would start crying
Hmm.
and it'd just be like stuff like that. And postpartum, they should have things like that too for women and they don't. That's why a
Yeah.
lot of women are losing their minds after having babies
Yeah.
because
I've got
of this stuff.
several people, I know several people who have either been at the point of wanting a divorce or have actually filed a divorce after a baby came into the picture. And like,
Postpartum.
and it's just like me going through postpartum with my wife, I can understand, but the thing about me is that this is not the it's not like there's such a heavy curiosity and the determination to figure out what is going on. Like I unfortunately have like this level of relentlessness to the fault where I gotta see what's going on. Like
You gotta know
I gotta know
everything. That's how
everything.
I am. I gotta figure out
Yeah.
like, is it this or
It has
this?
to make that there's got to be a math. Like I'm a big math person. Like the formula has to work, right? So when it comes to postpartum, like, and I want more women to know this. I want more women, and I want more women. First of all, from a male perspective. Well, actually, let me go back for a second. Let me first give you empathy. Um, culturally speaking, culturally speaking, when it comes to the other women, I don't know if you went through this too. My wife is Caribbean. The generation before you doesn't give you the grace and empathy, or even in many ways will even acknowledge the
The
postpartum,
color.
or they will water it down to a point where it's like, eh. So it's like I've watched
Mhm.
situations with my wife's family where they were, talking through postpartum, and I realized that, like, okay, there's a disconnect here and understanding what she's truly going through, and sometimes they would hang on to how she lashed out and less of what maybe caused her to lash out. So
Hmm.
it's
They
like,
don't want to find the cause of the problem.
right. So it's like, no, you're being rude. You're being rude, but like she's might be being rude because like she's over like there's just a lot
Overstimulated,
going on
yes.
emotionally, and she's
Hmm.
not intentionally trying to like throw daggers at you, but they're thrown. And the same thing happens for husbands, right? We as husbands, we're getting the brunt of it. A lot of men, after a while, like I
Don't want to deal with it.
it's not that we don't want to deal with it. It's just like after a while, okay. So it's like
It's too much.
let's say for example, you're going through it, right? And you pull out a sword and stab me. And maybe you pulled out the sword and stabbed me because there was a blindfold on your eyes and all you do was swinging around. You didn't mean to hurt me, but I'm still hurt.
You were there at the time when it needed to
I
be
still got
happened.
stabbed. I still took the blow.
Mhm.
So it's like when me and my wife were dealing with the postpartum and maybe we had like a disagreement, it's like she's not trying to intentionally be hurtful towards me. So I get that and I can give grace, but it don't mean the words and the bullets don't hurt. They still leave a wound.
Yes.
So now when you think about postpartum, yes, we are both going through it because I'm also carrying my own emotions and dealing with it
And
internally.
luggage from whatever else is going
But then
on.
you're also going through it, so I'm trying to support you. But at the same time, we may not recognize that we're both going through it. So then comes where more of the friction and conflict starts to erupt
Clashing.
because there's just a lot happening. Nobody knows what. There's no like you're. It's kind of like you're in a room. There's no emergency button.
There's no
There's no
indicators.
nothing. You're just here. Everybody's just taking it, and it hurts when I hear stories about marriages being dissolved after a baby, and you're like thinking about yeah, like you just think like yeah, postpartum probably, and like when you're going through postpartum from a male's perspective, it feels like it's never going to end, and that is who this person is going to be for life. That hits you. I think many men probably will agree. Like when we see our wives during that postpartum season, it's tough because it's like, okay, Monday we had like the best day ever, and we're just laughing,
And then Tuesday we're colliding,
and then on
clashing
Tuesday you
heads.
woke up and you're like, I told you 3 times. And like the day starts like that. I asked you to do this 3 times, or when are you gonna finally? It's like that's how the day starts, and then it just kind of like as men, you kind of like after a while, like it's like you kind of go into a space where like you're not realizing that you're being attacked. Like that's the crazy thing about postpartum, and the wickedness part about it is when you're being attacked, you don't even know like it's coming from
Yeah, it's
postpartum.
happening.
So it's like
Hmm.
you're it's like on Monday we were just in this euphoric state. We were happy and just chill. Tuesday you woke up feeling away due to the postpartum, and then here comes the attacks. But as a man, you're just like, whoa, whoa, whoa. And then your natural response is to like, hey, wait a minute. Like you're gonna like,
Like a chihuahua.
yeah. So it's like that's where postpartum I feel like is so brutal because it's like it comes when you don't there's no warning. There's no like, oh, it's kicking in. There's no like your wife doesn't like her head doesn't shake and spin and she doesn't spit out vomit before it happens.
Mhm.
It's just you could just be sitting there watching TV and like all of a sudden it's like, you know, it really bothers me when and you're just like, what? And then it just continues going, going, going. And then before you even have a chance to mentally catch on that this is postpartum, you're already like knee deep in like, okay,
In the
in the
argument with each
argument.
other. Yeah.
So there is no turning back at this point. And that's the part about postpartum where it's like, damn, we gotta talk about this more because so many people are going through it. Sorry, let me turn the mic down. So many people are going through it, and it's a battle that I also feel like to your point when you mentioned like women are also shameful of it. Like it's like
Hmm.
why should women be shameful of? It's kind of like the person who says I have to go to the bathroom and like you're shameful like you gotta go to the bath like what?
It's normal,
There's
you
no
know?
shame in it. But like if you take shame and keeping the postpartum to yourself, it can actually hurt you. I almost feel like let's talk,
And others around
let's
you.
talk about it. Let that out. Tell people, yo. And I think others around you, when it comes to postpartum, there should be a level of grace, right? There needs to be an
Mhm.
education of like, okay, they just had a baby. If there is a moment where that person calls me, and
Funny you say that.
you gotta,
Because years ago in the hospital, when you delivered a baby, I would say roughly from 2015 to maybe 2019, you would have to watch a video
mm,
of things before you were discharged with your newborn. They don't do any of that now.
interesting.
They don't do nothing. And I didn't know about postpartum until I've heard of it, but I didn't know about it until my grandmother kept pointing it out at me. And
Wow.
it wasn't like, obviously she knows signs of it because obviously she's older, she's been around the
Right,
world
right,
and back again. And for her to come out like that and say it like that shows that there needs to be more education on it. Because if she can say that to me, what do you think people that aren't your family,
right.
people that aren't aware of it?
So this is interesting. So what you're saying is throughout your journey and the doctor visits, the doctors never, there was no like preparing you, even when you, because you had to see the doctor after you delivered both children, right?
Hmm.
Was there a conversation that says, hey, you might start to feel extreme emotions in a couple of days to weeks?
Nope.
So,
All they said to me was, do you want to speak with a grievance counselor? And I told them no, because I see a therapist already.
okay,
I know they're different, but it's still somebody to talk to that will collaborate and talk with me, and won't judge me like if it was somebody that knows my situation and that will judge me.
right.
But postpartum is on both ends. I could say it's more on the female end because we are like piranhas
Mhm.
and we take it out on the men because we know you guys love us and we think you can handle our luggage on top of your
Wait
luggage.
a minute. You drop you are you opening out the book? Should you telling all the secrets and letting us know what's
I
really
mean,
good?
that's just how I feel.
Sure.
Like, I think it's both, but
Hmm.
it's more on the woman, obviously, because the hormones.
Yeah.
But it's not an excuse, but it is an excuse. But it's both genders,
S-
and the woman turn into piranhas
yeah.
because of all the hormones, and you're like the first target. And the reason why I can say that is because that's what I did. What you're explaining, what your wife did to you,
Mm,
I did it to my
yeah.
husband.
You're the
And
easy kill.
I think it's because we feel like you're our safe zone. We know that you guys are gonna love us. That's what I think, but
So you beat up the
I
stays.
say sorry. That's the thing about me. Whenever me and him, when I was going through postpartum and I lashed out for whatever stupid reason I lashed out, I'll sit on the couch and I'll be thinking about it. And I'm like, damn, I was an asshole. And I'll go and I'm like, I'm sorry. I don't mean to be like this, but I explain myself. I'm a very blunt person. And if my husband came in here right now, he'll tell you, like, if I'm wrong, I admit to my wrongs. It might not be right then and there.
Mm.
Let a couple hours go by and I'll come and I'll walk in the room while he's playing his game or something and be like, babe, I'm really sorry. I don't know what's going on with me, but I'm just a wreck.
Mm. Is he
That's
playing the video game trying to like put his arm back in his socket and saying, that's okay?
well, I've never physically touched
No, no,
him.
I was
My
just being
it's my
metaphorically speaking. I was
words.
just saying metaphorically speaking. Yeah,
Yeah, he'll be like,
yeah.
but my thing is when you're going through postpartum depression, don't don't beat yourself up. Don't make it feel like it's something bad because there's more women that go through it than what they show.
100%.
And it should be out there more so people that aren't aware of it, they can be aware of it,
Sure.
but also so they feel comfortable of coming out and saying, I think I'm going through postpartum. What do you think I should do?
Sure.
Is there counseling? Is there, I don't know, should I have take my husband's card once a week and go spend money at a store or something,
Yeah. Yeah.
like
Yeah.
what can I do to make myself a better woman
Mm.
going through postpartum so that I don't drag my husband down with me
Mm.
and then cause our marriage to go in the gutter.
Right. So if I'm hearing you correctly, it sounds like what you're saying is you yourself didn't know what postpartum was until maybe your grandmother gave you some insight from her point of view.
Mm-hmm.
Your doctors along your whole journey, nobody kind of like set that expectation that this could happen.
Nope.
And then a lot of women, probably more women than we're counting, probably go through postpartum, but they're just going through it.
Hiding out.
So is postpartum the issue of postpartum? Is it a lack of do is it fair to say that not enough?
I can give you an example.
Sure.
So you know how the whole LUTO thing
Yeah.
and us losing our sons, how the woman doesn't feel comfortable telling people because we think it's our fault.
Yes.
It's kind of like that.
You think postpartum is your fault and it's a you thing.
That's how I feel. I
Sure.
can't speak for other
Sure.
women, but it's like it's my body, it's my hormones, so I feel like it's my fault. I knew what I was getting myself into.
Mm.
How do I do this without letting anybody know that they don't judge me and bring me down more than what I already am?
Wow. And I think it's interesting. The reason you probably feel that way is because outside of your grandmother, have you heard anyone in your circle or any other woman speak about postpartum?
Nope.
So you would have felt like, even though it's like,
I'm the only ball. I'm the oddball. That's how I felt.
so
I Out of all my friends, all my family members, I'm 30 years old. Okay? Out of everybody in my family that is a female and that's had a baby, I've never heard anybody go through postpartum. I've never heard postpartum
wow,
until a little older. Not it was before I had kids, but it's like
wow,
you don't hear about it unless it's on the news about a mom losing her mind going through postpartum or
oh,
just something tragically happening. That's the only time you see things about postpartum. And it shouldn't have to get to that extent for it to actually be taken care of.
oh, wow,
Because now that you sit there and think about it, that woman I was telling you about that killed her 3 kids after she had her last baby,
right.
now that she's sitting there and everything's being told to her, it's killing her inside because
It's not
it's
her.
like blacking out.
Yeah,
And she's beating herself up for it now.
I agree, and
It should not get to that point.
do you.
There shouldn't be
I
people.
agree. Do you remember several years ago, there was a woman, I think she was in Houston or South Carolina. She had 5 children and she drowned her five
Yep.
children.
Yep.
And I remember I was like I was really young when I saw the story, and then I remember like just coming across it again because I remember she actually went to the I think she was trying to get either an appeal or try to go for parole, and they denied her. And I just remember like that is a situation that someone really needs to look into because no, like this is the part where I feel like society, like as me being a male, this is where I can help women in society, where it's like nobody's really nobody took that moment where that woman drowned her kids or any woman killed their kids and said, I wonder what's causing this. You looked at them as if
They were a bad
you were a bad
person.
person or you just had a crazy moment, but no one's really looking at like the,
They got to sit there and
the
think.
extremes.
She had all these kids. She had them for a reason. If she didn't want them, she could have gave them up for adoption or she could have got an
And she
abortion.
was married.
Why why would she raise these kids for 5 years if she didn't want
Right,
them? Obviously something in her brain, one of the stems in her brain wasn't working right
right,
because of postpartum.
right.
Postpartum is it's like having mental issues.
Right. And then when you think about that too, and based off what you said, so I could easily see women looking at her story saying, oh, she killed those kids because of postpartum. I definitely don't have postpartum. But what they don't realize is
It's all
it's
different.
all different. She may have had a really extreme case of postpartum. Like, you wouldn't punish a person who has schizophrenia for a crime. Like you know what I'm saying? Like they have schizophrenia. Like we should treat postpartum as a mental health issue.
Illness, it
But
is.
at the
That's
same
what it
time,
is.
it's not fair that we give it a stigma that says, "Oh, you have
Hmm.
postpartum. That you must be." It's not fair because it's like, like we should just come out and say, "Listen, all women who have a baby will deal with postpartum. the way it impacts the
Can't
person.
say all. Some are different. I know some women do, some women don't. But the thing about it is, there's different levels
Yep.
to
Sure,
postpartum.
exactly.
There's mild, there's low, and then there's
Right,
all over high.
right.
And when you see it higher, is when you see mothers abusing their kids, or you see them on the news
Mm,
because they killed their kids or they killed the father, or they did something.
right.
It it needs to be addressed.
Yeah,
Instead of calling her a crazy woman that killed her kids, she was suffering depression. You don't know what she was going on top of the postpartum depression and taking care of the kids and what was happening in her life on top of the postpartum.
right,
Because you could be, it could be something from 10 years ago that pops up in your brain and you're just like nagging at it.
right.
So I don't
Or
know. I
especially if you have
just,
some kind of like trauma in your life, right? That that trauma could be
definitely trigger.
flare all kinds of crazy things up. So, um, I'm gonna do a whole nother episode on postpartum because I want to kind of have like a round table where it's like, okay, like here's our perspective from a male and your perspective from a female. Like, how do we find the middle ground to navigate through postpartum together where everybody feels love, but like also for men, when you are having a moment, because it's tough. It's like on one hand, the woman doesn't always know when she's having a moment. For her,
Mm-hmm.
it's like, what? It's Tuesday. Like for us, it's like you just blew up half the city. Like
Well, that's why I told you when I noticed it. Some women might notice it, some women might not. That's why I say communication.
yeah,
Communication is the key to success. That's what I was always told. If you're feeling not like yourself, express it to your partner. Express it to somebody that you feel comfortable expressing it to, that you know won't judge you.
right.
Because it'll take one person to save a mother that is going through postpartum.
Mm,
Like just like a shoulder to cry on. Like,
yeah,
I, I don't know what's going on with me. I My thoughts are everywhere. Just you got to communicate. You got to express yourself.
yeah,
If you feel, what's the word, ashamed or anything to that extent when it comes to something like that, don't be ashamed, because there's plenty of other people in the world that go through it and it's not spoken about more than it should be.
right.
And we got to come together as a team and help each other. And
Yeah,
if doctors can't do it, then who's going to do it?
right.
Someone's going to have to speak up. Someone's going to have to be that big brother, big sister that they always wanted to,
Mm-hmm.
tell them their secrets, or, express their feelings.
Mm,
And I think that's the best way to go about it. Like,
mm,
don't close yourself out.
mm.
Go to somebody that you trust, that won't judge you and will be there and help you and guide you and do the things that you need to do to get out of postpartum depression, because you can get really deep into postpartum depression
Mm.
and sometimes it's really hard to get out. Because I'm gonna be honest, with my daughter, I had postpartum depression for almost 2 years.
Wow. And everybody
And
tells you that.
and it wasn't an everyday depression thing. It was just random little sparks.
Yeah,
And it'd be like, where the hell did this come from? Like, I was just fine. Why am I feeling this way? Like, what's going on? Like, I question myself all the time.
yeah,
To this day, I do. And I'm like, I can't beat myself up and I can't take it out on other people. And after talking to a therapist, like I tell him all the time, we got to speak to each other. We got to communicate with each other. We're a family, we're a team. We're not opponents. We're both fighting for the same things.
yeah,
And we got to hold tight. It might be rough and bumpy right now, but if we're really willing to work with this and get over this obstacle, we're going to do what we got to do.
yeah, yeah. So sounds, yeah. So The key to all of this is it starts in the foundational stuff, which is communication.
Hmm.
And a lot of people, including myself,
Don't be ashamed.
yeah, and don't be ashamed of postpartum. I I like a lot of people, including myself, didn't didn't know. Like it's like I'm super eager, super hungry to figure out the answer, but like sometimes like the answer could be so simple, and it's just like it doesn't click at times. Um, I also realized that during postpartum, you have to slow down significantly.
Yep, don't rush it. You want to sit in the house all day for a week in pajamas? Go right ahead.
Right,
You want to leave the laundry of clothes stacked up on the couch for a week? Go ahead.
right.
That's what that I think that's what caused my postpartum
Mm.
was wanting to be the person I was before I got pregnant
Yeah,
and was holding myself back.
right.
And then I'm like, okay, how am I going to juggle a baby and doing all these tasks?
Yeah.
Take your time. Don't rush to be the woman you were before you got pregnant.
Mm.
Them dishes that are sitting in the sink, let them sit there for a day or two. Just relax. I think that's what it is too. Women want to be, the mothers, keep the house clean,
Mm.
make sure dinner's cooked, the kids are washed, stuff like that. I think that's another thing
Yeah.
that kind of triggers postpartum.
And then to add to that, right? So from your point of view, right? That's well, but now what the dad sees is something completely different. So when you
Mm-hmm.
say leave those clothes on the couch, leave those dishes in the sink, leave the house a mess, the dad is gonna see, and I'm not saying this to be a chauvinist or anything like that. I want to keep it 100% real. The dad's going for work during the day. He comes back home, finds you in the same spot, just chilling, watch TV. In his mind, he's thinking to himself like, "What is like? What'd you do all day? What's going on?" And
Mm-hmm.
the woman's mind, it's, dude, just me sitting on the couch today was a was a like just,
Mm-hmm.
but nobody talks about that, including
That's
the
correct.
woman, because the way you're breaking it down for me right now, right?
Mm-hmm.
I mean, listen, I've gone through the same thing where it's like, okay, my wife was gonna do this, this, and this, and then it's like nothing happens. So it's like it comes off as like, okay,
You have the motivation to do it, but then the postpartum depression kicks in, and you're like, I don't even want to do this. Forget it.
mm. And that's where like that's point right there where conflict can start, because the dad's thinking, I'm working, I'm coming home every day.
And you ain't doing nothing, just laying here on the
There's no
couch.
food, there's no nothing. You're just laying on the
And
couch.
that's where I said communication. If you don't know you're going through postpartum and you don't know the signs of it, if you're feeling not yourself after having a baby, don't be scared to tell your partner, like, I don't know what's going on with me.
Mm,
My mind, my body, whatever you feel is going on. And in order for, like how you said about the cleaning the clothes, leaving the clothes and
right,
stuff there,
right.
if me as a woman doesn't express to my partner, hey, you know, I don't know what's going on with me right now. I'm in a funk. I don't feel like myself. I don't want to do anything. I feel
Right.
depressed. You both have to be on the same page in order to know, because like we said, closed mouths don't get fed.
Mm,
If you don't express to me you're not feeling like yourself, I'm just going to be thinking you're just being lazy and don't want to do anything.
mm,
You know what I mean?
mm,
And same thing with the guys. If you feel like you're going through, because guys go through postpartum, even though it's not called postpartum depression for
right.
men, but you guys go through that change too, because yes, you didn't carry the baby, but that baby's in your life now. You have to take care of that baby as well as your wife. You know what I mean? So you can be like, oh my God, this is all new to me. Like, how many ounces of water do I put in for, the formula,
Mm-hmm.
or, you know,
Mm-hmm.
oh, damn it, I forgot to get diapers while I was at the store. What the hell? Like,
Mm-hmm.
there's things that men could feel like that too. Like, you could feel like you're not doing enough as a father
Yep.
and being depressed. You know what I mean?
Yep.
Like, It falls on both ends. That's why I think that the medical field, they should have it for both,
Amen.
not just for the woman.
Amen. Amen.
Because if I'm going through it, my partner's going through it, and I don't care what anybody says.
Amen.
Because if I'm giving it to them, they're giving me the same energy.
Amen. Amen. I am definitely going to see in the future if I can have a therapist who specializes in postpartum and do an episode. I would love to have you come back for that
I'm
episode
down.
and like have a roundtable to talk about it and figure out like what how do we like just literally like play in the sandbox.
Hypothetically thinking, like, what do you think if like we do this and we come up with a page on Facebook for people going through that, and we have people that have went through it and that could help other
Yeah,
people. You know what I
I'd be down
mean?
for
Like,
that. 100%.
cuz it's nothing easy. Being pregnant and bringing a baby into the world is not how they make it on
It's
TV.
not.
All happy
I
and
oh
go-getty.
yeah, that's the thing. And now we didn't
They
even
lie on TV.
we didn't even touch on family and friends during postpartum, right? Like we gotta that's a whole nother beast in itself dealing with family and friends during postpartum because it's like there are some strange expectations
Mhm.
and there's not enough sometimes grace and understanding and care and it's just like we yeah but I wanted to I know we've been going for two hours and this has been super fruitful of a conversation but I wanted to kind of close this here because that is the limit I'm allowed to have but
Okay.
if we will definitely continue to have dialogue so
If you want, just message me on Instagram.
yeah do you want anyone to know your Instagram?
I don't care.
Okay. Do you want to call it out? Because I'll have it part of the clip.
I'm gonna be honest with you. I forget what the
Okay.
name is.
Okay. No worries.
I've
I'll
had it
tag you
for
in the
like
videos.
10
I'll have to
years.
make sure it's
I
tagged.
think it's tatted up, Blanquita.
Okay. Tag it up, Blanquita. So what I'll do is I'll make sure I tag you and everything. So if people want to reach out to you,
And I'm gonna share when you post this. I'm sharing it on my Facebook page so everybody in my
awesome.
family can see.
Awesome.
And I gotta share videos with me before it hits 2 o'clock. You know the show House,
Yes.
the Doctor House.
Yes.
There's an episode on Ludo.
Oh, really?
I have it saved on my phone, and I'll send it
Yeah.
to
Send it to
you.
me. Send it to me. Um, if you had to say two things, if you had to give advice for men during who are going through Ludo with their partner, and what advice would you give to men after that the baby has passed on and we're now in the postpartum season? What two advices would you give to men? Like if you had to say
All
like
I
this is how
can
you can nail
say,
it, what would that be?
the two things I would say is communication
Mm-hmm.
and being a team together,
Awesome.
not giving up.
Mm, awesome.
You need a backbone
Yeah. You need to,
for both of
yeah,
you.
you sure do. You need a little bit more. You need armor. You need
You need the army on your
yeah,
back.
you need a couple things, but yeah,
Yeah.
100%. I agree with you. Um, okay, well, Julian, I appreciate you so much for coming on the show. Thank you for sharing your story.
You're
I look
welcome.
forward to us having more dialogue. Um, and this episode will be posted shortly.
Sounds
Okay, so I just wanted to stop recording.